Now, you mentioned by far the most common headache is a tension headache.
Yes.
What is a tension headache? When you get nervous, you get a headache. What is it? What is tension?
Yeah, the current terminology is a tension type, because when you and I went through training, we thought it was muscle spasm or something. And even today, no one's exactly sure what the source of the pain is with a tension type headache. But what we know is that the description of it is really described in terms of what isn't a migraine. So it's a very interesting concept. So to kind of jump in with migraine, then we can relate it to a tension headache. There's what's known as the International Headache Society, and they have put out a classification for about 300 different types of headaches.
Wow.
And they have operational diagnostic criteria that has to be fulfilled if you're really going to feel comfortable making the diagnosis.
So how do you make how are you comfortable with the diagnosis of a tension headache?
With a tension headache is going to be the non-migrainous features, meaning that there's typically bilateral rather than unilateral. Now, it's not throbbing, so it's more of a pressure, a tension sort of feeling, not pulsatile at all. It can be in the front, the back, or the neck. There's usually, it's usually not severe enough that a person has to restrict their activity, so they typically do not go to bed. And activity of the general sort typically doesn't worsen it. Also, they do not have both nausea, or they don't have either sensitivity to light and noise. They may have one or the other, but typically not both. And typically, there's really no vomiting with it. Maybe a little bit of nausea, but not much.
So I take it on a scale of 0 to 10, 10 being terrible, it's down in the lower part, and you're able to do your activities, but you just got a headache when you think about it?
Exactly. It's a mild to moderate headache, and it can be an entity in of itself, but so many other conditions can be mimicking tension type headache. And that's where just stress in your life, maybe a flu, maybe you have some other infection, and in the setting of these other illnesses, that pattern of headache appears that is consistent with a tension type headache.